ladies, and welcome back to my channel. My name is Aisha, aka Nurse Aisha. For those of you that are new to this channel, welcome to our female to female conversations. Here you will receive health education from a nurse perspective. Please don't forget to subscribe, like, and comment. Now let's get into it. We are going to discuss preconception. Basically, how to get pregnant. Now, our female body is very complex and sensitive to hormonal imbalance. So everything can matter when you want to conceive. Everyone's road to conception is different. We are individuals, so the road to conception will be different for me, for you, and for everybody that wants to have a healthy pregnancy for 9 months. Where do we begin? We begin by preparing our bodies. Like I said, some of us don't need to plan. Some of us will get easily pregnant, while the rest of us have to try over and over again. So what you need to know are simple but very hard information that you need to prepare your body for. So one of the factors of trying to become pregnant could be your age. Obviously, it's easier for younger women to get pregnant, but that is not always the case. For older women, you have to prepare more. But for us older women, science is on our side. Yay! Thank God for science. But before we get into that good stuff, let's discuss on how to get pregnant the natural way. Number 1, if you're on birth control pills or family planning, stop and get jiggy with it. Start having sex, and plenty of it. Number 2, this is when it's very important for us women to be knowledgeable and plan our menstruational cycle. You need to know if you're regular or irregular. How many days is your cycle? When can you get pregnant? So over here is a circle that represents our female cycle, our menstruational cycle. There's 4 phases. Number 1, the menstruational phase, where you bleed. Everybody knows that, right? Number 2 is the follicular phase, when the egg is forming in the ovaries. Number 3 is the ovulation phase. Lucky number 3. Now this is where you want to plan your pregnancy. This is when you should get jiggy with it, ladies. This is when you're supposed to get pregnant biologically. Number 4 is the luteal phase. Nothing much happens here. So what I want you to focus on is phase number 3. This is when you want to have the sex. This is when you are fertile. This is when you can get pregnant. Now, the ovulation phase is a very short period of time. For some women, it's only 2 days. For others, it's 3 to 4 days. It's very important that you monitor these days. Now, you can get instruments for that, where you can find out when you're actually ovulating. You can go to your local pharmacy and get that test. It's just like a pregnancy test, but instead it shows you when you're ovulating, so you can get jiggy with it. But before you try this at home, you have to make sure that you're healthy. You have to see a doctor about your pre-health conditions or pre-medical conditions, such as HIV, diabetes, hypertension, obesity, and also if you're taking prescribed medication or medication over the counter. And this is very important, ladies, because this could cause severe birth effects on your baby. So it's very important that you make sure that you're not taking medication that is not prescribed. And if it's prescribed, ask your doctor if this could be any danger to your child. Now, medication that you want to take while planning a healthy pregnancy is folic acid. Folic acid is a B vitamin that is important for us females to take while planning a healthy pregnancy. This helps with our fetus not to develop any severe defects. Now also ladies, a very important factor while you're planning a healthy pregnancy is your lifestyle choices, your smoking habits, your drinking habits, your mental health. You have to get this in check while planning a pregnancy so that that doesn't affect you while pregnant. It's a long journey to carry a baby for 9 months. So you want to be mentally healthy. You want to be in the best shape for you to carry out a pregnancy for 9 whole months. So now you are pregnant. What can you do while you're pregnant? Once you actually manage to get pregnant, it's very important to go for regular checkups with your midwife or a doctor if you need a doctor's surveillance while pregnant. Now, some of us experience healthy pregnancies all throughout, and others need specific monitoring, which brings me to a word that I love to hate: geriatric mothers. If you are a geriatric mother, you are going to need specific monitoring by your doctor. And this is because there's higher risk for different complications. Geriatric mother are everyone, all of us, me included, having a baby after the age of 35. Now you're asking, what is a geriatric mother? Geriatric basically means old. Women above the age of 35 planning a pregnancy are considered to be at the older side, though we're not old, but biologically we're older. That means that there's higher risk for different complications as we are carrying a child for 9 months or less. Now, complications that are risky for a geriatric mother are preeclampsia, gestational diabetes, high blood pressure, deep vein thrombosis, and also birth defects, unfortunately, such as Down syndrome. So this is the reason why we need to be monitored closely every week, every month, more than the younger ladies. But that's okay. You need these follow-ups, you need these controls by your doctor so you can actually manage to carry a healthy baby full term. So you've taken a pregnancy test and it shows 2 pink lines. Congratulations, you are pregnant. Now, the first steps of knowing if you're pregnant usually is you miss your periods if you're regular, and then you might get other symptoms: nausea, constipation, fatigue. You're constantly tired and you can't really figure it out. Now, if you've been planning a pregnancy, this will not be a surprise, but if you haven't planned, then you might want to take a pregnancy test. So the best thing to do when you do find out that you're pregnant is to seek good maternal health. You need to look for a midwife or a doctor, a general practitioner, to go through your pregnancy. Now, depending on where you are in your reproductive years, this will look a bit different. If you're younger, say this is your first child, you might need extra visits to your midwife. Some women will go through pregnancy, the whole 9 months, through just a midwife and never need to see a doctor. But just like I said, depending on where you are in your reproductive years, you might need some extra care. First-time mothers are going to need more care, as well as our geriatric mothers. Also, the ones with pre-medical conditions can need extra care. Now, also depending on where you are in the world, if you're in the West or East, it will also depend the kind of maternal health care that you choose. Or you can actually get someone that you know is good, that you maybe have heard from your friends. But remember, do not compare. Your pregnancy is individual for you, not anybody else. So now we are in our first trimester. Your breasts are sore, your mood is weird, cravings perhaps, nausea. But if this continues with nausea, you definitely need to see a GP about that. This trimester, the first trimester of your pregnancy, is crucial. You need to seek maternal health care for you and your baby. You will get information about the whole pregnancy journey for you, personalized for you and your family. This is where you want to include your husband or your significant other. This is when they answer your questions about your fears, your expectations, to help you through a healthy pregnancy. Your physical care, what you need to do during your pregnancy. Lots of screenings will happen here and the second trimester as well as the third trimester. But the first trimester, what we need to focus on is keeping the baby where it is. Now, depending on where you are in your reproductive ages, this could be something that you need to focus on. You don't really need to change much. Maybe if you've been unhealthy, try and choose healthier lifestyle habits. You need to be careful in this first trimester as well as the second trimester. Obviously, miscarriages are very common in the first trimester. It's very important that you talk about this with your midwife. Now, during your first trimester, you will also need some blood samples. You will need to check with your partner, genetics. If you have any heritage for any kind of disorders, you talk through this with your doctor or your midwife so you can get these blood samples done early on. The first trimester, we focus on finding out about your medical conditions. Anemia, HIV, syphilis, blood counts. You might need medication to help you through your first trimester. And depending on how you feel, if you have a lot of fatigue, this could be iron. So you might need iron supplements. And if you haven't been taking your folic acid, this is when you need to start. Give this information to your midwife so they know how to go about this. So now we are in the second trimester. In the middle of your second trimester, this is hopefully when you find out your baby, when it's due. Your first ultrasound also happens during your second trimester, around week 8 to 14. If it's your first child, you might get extra care and know what to do. Already in the first trimester, as you're planning your pregnancy and your journey with your midwife, you should already in your first trimester figure out what you're going to do about your job. Now, if you're a nurse, like I am, or you're a doctor, or any kind of physician working with dangerous products like antibiotics or chemotherapy, or you're working with radiation, it's very important that you let your boss know that you are expecting so that this does not harm your baby. It's very important that if you're working with any type of job that is dangerous, like heavy lifting, you could be a cleaner, you could be a driver, or anything like that, you need to let your boss know. Now, if you're your own boss, then you can make that decision so that you can keep your baby safe. Now, second trimester, some women might be getting a bit heavier, but nothing to worry about. You need to know from your midwife and your doctor is that your baby is growing and that you don't have any other conditions to worry about. If you are a geriatric mother and you need more care, you might need extra visits. Now, you might be a geriatric mother, but you might be physically fit, but you might be 33 and treated like a geriatric mother because of your pre-medical conditions, such as obesity. Now, people that have a bit extra weight might get extra visits because of their weight. So you might need extra medication. That could also be if you have any pre-medical conditions that might harm the baby in terms of preeclampsia. That could also be information that you've given your midwife if this is, say, your second or third child. So this is when you discuss conditions that might affect your pregnancy, your child, and yourself. It's really important that we go for these maternal health care visits to protect our maternal health, our newborns, and our children after this time when they're a bit older. And also before, during, and after pregnancy, healthcare is also important. There's so many things that happen during a woman's pregnancy, physically and mentally. It's very important for us women to accept and digest what's happening with our bodies, depending on how we got to this space. Now, our bodies are growing. We're getting ready for labor. So we're now in the 3rd trimester. Now, you might feel a bit afraid. You've heard so many stories, but remember, this is you going on this amazing journey. This is why it's important to lean on your midwife. Ask all the questions. Make sure that you read how a woman gives birth to a baby. This is when you decide about your birth method. So depending on your prior experience, or this is your first experience, you might choose differently depending on what you've read about and what you prefer. It's very important that you choose a method that is good for you, natural, and nothing that you're pressured into. You might have heard this method is better, that method is better. Many women talk about how they don't want to interrupt their bodies that are designed to birth. Ladies, if you are one of the lucky women to have a normal vaginal birth, kudos to you. There are so many fearful stories about a vaginal birth. Let me tell you that is the most nurturing thing that can happen to your body. You might have had prior traumatic experiences, but really this is when maternal health care comes in. The normal, most natural way to do it is a vaginal birth. Some of us cannot do it, so we might choose a C-section, and that is also okay. Make sure that you make your decision based on good grounds. Now, there is so much to cover when it comes to maternal health, and it's all because an individualized and personalized healthcare for you and your baby, and it all depends on your health, your previous medical conditions, and also how physically fit you are, your diet. So when it comes to physical exercise during pregnancy, if you're a runner, you can probably continue running all throughout your pregnancy. If you do other kind of exercises, please make sure that you ask your midwife if you can continue to do this. Also, what I need you to remember is our geriatric mothers, do not this age fixation disturb your journey. So you're 40 years old and this is your first child. Depending on your physical well-being, you might be healthier than a 30-year-old woman. So your age might be a red light, but then your physical well-being might be the best. You might be in your best shape ever at 40 and be able to birth a child naturally without any complications. Now, if you do have any other complications or pre-existing medical conditions, you definitely need to go through the same journey as other women. If you have any questions, please don't be afraid to put them down and I'll try to answer them as much as I can. Everything about maternal health care cannot be answered in this one video. So if there are any questions, please drop them down below. Good luck with your baby and good luck in your maternal health care and pregnancy journey. And the best of luck with your newborn baby. Congratulations. And remember, be kind to yourself. Always ask for help when you need it. Thank you for watching. Happy, healthy, and female.